Just finished it.
All right. Good morning, everyone. Time being 9 a.m., I'd like to call this meeting to order of Kane County's Public Health Committee. Clerk, please call the roll.
Lewis,
Of the date, Wednesday, September 21st, 2022.
Lewis,
Who's here?
Shepro,
Shepro present.
Strathman,
Strathman here.
Pepe,
Happy here.
Wallace, Silva,
Silva is here.
Sanchez.
Sanchez present.
Yep, quorum.
Okay, I'd request somebody ask for unanimous consent to approve the minutes of
So
August.
requested, Mr. Chairman.
Mr.
Shepro request.
Any objections? Okay, the minutes are approved. Finance and budget. Anyone have any questions for Mr. Snowden on this month's financial report for the Public Health Department? Okay, hearing none, we'll move on. Public comments on agenda, and we'll also take non-agenda items if there are any. And I don't see anyone in the audience here. I don't see anyone unfamiliar online. So we'll move on from public comments and go to animal control. Brett?
Good morning, everyone.
Two quick updates. One is about the rooster video that was brought to the county board. I just want everybody to know we are still working on it and we are trying to get it to the proper authorities to make recommendations on that situation. As for the other case that happened in Campton Hills, there's not much I can say as that's an ongoing court case at this moment, but the animals are being housed at animal control facility. We do have 3 events that are coming up before our next meeting. 2 will be vaccine clinics. One is this evening from 4:30 to 7 o'clock, if anybody's interested. The second one will be October 1st. That's a Saturday, about a week and a half away, and that'll be from 10 to 1 o'clock. We're very excited. These are our last 2 events, and we did a large, with the help of Julie Mann, Facebook campaign that was amazing. Our last Saturday clinic was packed, so packed that people said, I'll see you at the next one. So we're really excited for these next 2. This has become a huge thing for this county and people really love it and they find it very beneficial and helpful, especially in these times with money being so tight. And the last thing I have is our largest dog wedding will be October 2nd at Northwestern Stadium where the Cougars play. Advertising has really ramped up. An email went out to everybody here in Kane County that they were doing free registration for all the animals of county employees. So that was exciting and really nice of them to do. And they're not waiving waiving the fee. They were actually, the group organization who's putting this together is actually paying the fees of anybody who does that. So if anybody's still interested, please sign up. If anybody would like to volunteer, please do. And if you have a dog that does not have a significant other, they are doing speed dating at about 8, 9 o'clock in the morning. So your dog could find their other at speed dating. And that's all I had for this one.
Any questions?
Yeah, Tepe here. It's the kind of event that I think we should be behind, and I'm serious about that. You know, it's the kind of event that, you know, is a fun event. It's positive. You know, there's nothing negative that can come from this. And I think that we should be promoting it, and I know that I will be promoting it. So I think it's a great idea. We can go out and have some fun.
I just always heard you weren't supposed to stand behind a dog.
No, it's a cow.
Yeah.
A cow, okay.
Silva, question?
Dr. Silva, go ahead.
Good morning. Thank you, Chairperson. Brett, my question is regarding rescues. I periodically go on the website and I noticed that we had a couple of dogs for rescue, but not adoption. Could you please explain the difference?
Yes. To make it to our adoption floor, you have to pass our medical and behavioral evaluation. And we do our best to ensure that animals are as safe as possible that we put into homes. Animals that might have an issue in a medical and need a little bit more medical attention or need additional medical treatments, or an animal that has a little bit more of a behavior issue that might need to be worked through with a trainer, with a behaviorist, or just be into a foster home to allow the animal to start coming out of its shell, we'll work with our rescue partners. And here in Illinois, you have to be licensed through the state of Illinois to be a rescue agency. So it makes it great that we have this huge network of rescues we can work with. It's a chance to get the animal to where they can get some additional resources and be able to then place in their forever home. So it really is an amazing opportunity to still allow these animals to get out and still have a chance on life.
Oh, thank you. And then do we do any fostering we don't do any fostering programs through King County, do we?
No, we don't have the staff to be able to keep up with a foster program because you would need a coordinator in themselves. So we actually work with a lot of agencies that do have fosters, and we actually promote their fosters, because if we can push people their way, then they're going to take more animals from us.
Okay, thank you.
Of course.
Any other questions for animal control? Okay, well, thank you, Brett, for the updates. Next on our agenda is the Health Department. We'll go to Executive Director's report, Mr. Isaacson.
Great, thank you. Good morning, everyone. I just have a brief presentation to go over some highlights of some things that are going on around the county right now. And we do have the COVID information is down to 1 slide, and hopefully we'll be at 0 slides sometime soon. So fingers crossed. Great, thank you. All right, so I just want to talk a little bit about the prevalence of COVID in the community. Just to note, the chart on the right, you'll see it is cut off, and this is one that we've shared over the months, but the only way to make this useful to look at is to cut off that huge spike that we had over the winter. So if you remember when we were having like 4,000 cases a day, so that's intentionally cut off. Otherwise the rest of the slide looks flat. So you can see just looking at the graphic on the right, we are on a nice downward slope. Over the past week, we've averaged 92 cases reported per day. And you can see over the last month, we were averaging 121 cases per day. So we already have about a 25% reduction from the last week as opposed to the last month. So that's good news. Again, the caveat here is this is cases that are reported to the health department. So if people are doing home tests or they're not testing, we don't have that information. Hospitalizations have stayed pretty low, so that's good news. I did want to point out, however, that there was a little spike in deaths last week where we had 7 deaths in Kane County that were attributed to COVID. We've been averaging about 2. So as kind of the common theme here, things are looking better, but we still need to be very careful. We do have a resolution on later in the meeting that we just want to purchase some additional test kits. Because it's still very important for people to be tested so that they can take protective actions and especially stay away from people who may have a health condition or be in an at-risk group. And want to point out Laura and her team did a fantastic job on Saturday. We started offering the bivalent vaccine, had over 500 people go to the Vax Hub. We are looking at the potential future there at the hub, what the demand may be. We had another clinic for the little ones on, what was that? Was that just yesterday, Tuesday? Where we had about 30 of the younger kids come out for vaccine. So there may be some utility in keeping it, but there's also starting to be some dual use of that facility with the Chicago Tribune is actually using it. So we're monitoring the space and want to make sure everything still meets our needs. So there'll be more information about that as we get more. And we are looking at a couple of other opportunities potentially to make vaccine available in different places as well. Any COVID questions?
Yeah, Shepro, what day were the bivalent vaccines administered?
That was on was that the 17th? Do I have the wrong date? 17th. Yeah.
17th. So last Saturday.
Yeah, it was Saturday.
It's not in the future.
Yes.
is what you're saying. Yeah.
Yes, correct. Yeah, thank
Got
you.
a line on the future. Let us
Yes.
know now.
Yes.
We'll change the tone of this meeting real quick.
Yeah, we could make some
Right.
useful investments probably.
Yes.
Bates, please.
Ms. Bates?
Do we know if the people getting COVID and being hospitalized and even deaths, are those vaccinated people or non-vaccinated people?
It's, I don't know, I'll turn to Director Onwuda to see if we have that data.
We have some breakthrough cases. The vaccine is over the months that we've been given the vaccine, we've had some breakthrough cases. Yeah.
So yeah, so nationally, we still see protection from serious illness and death. But as we've seen over the past several months, it seems like everybody, has had COVID. So whether they're vaccinated, boosted or not, but it is still protecting people from serious illness.
And the new vaccine
Right.
may prevent the breakthrough cases?
Yes, that's the expectation. The bivalent, as opposed to monovalent, which is what everyone has received up until the month of September, is got both strains of the original Omicron and the new Omicron strains are included in that. So it's got both. And as you can see very well by the chart up there, that was the, significant surge that we had last winter was the Delta waning into the Omicron variant. And that's the one that still is out there, very prevalent in our community too, is the Omicron rather. So the expectation is this bivalent vaccine should help continue to resolve those outbreaks as we're having those, and those surges will be lowered as the months go on.
Are we recommending that everyone get that new booster?
Yes,
Okay.
That was Laura Barrett speaking, just for the
yes,
record.
yes, sorry,
Since that
sorry
was-
about that.
It's okay.
And our Tepe here, are there schedules for the vaccine to be administered for the next couple of Saturdays, or when are they?
No, we wanted to see how it was last weekend, what the turnout was. So we do have some additional vaccine that's on hand and we're just looking at staffing right now. We did just, the board just approved our new union contract, which raises our nurses' salaries. So that's good, but we currently have more vacant positions than we have filled positions. So we're monitoring where's the demand, where can we best be of service to the public so that we can provide these clinics. So we haven't posted it yet, but there's more coming.
And these are also, Shepro, these are also available through pharmacies and so forth as well, right?
It's readily available. Yes, sir.
My wife and I did it the first day at Walgreens, and it was a little crazy, but they were having computer problems and everybody got taken care of.
Yeah, so that's one thing we'll continue to keep an eye on, but as far as we've seen so far, the new vaccine is widely available in most of our communities in King County. So
Any other-
Shepro, one question.
Go ahead, Shepro.
The deaths, for a while, my impression is that most of the deaths were people who had been ill for a long time. They weren't new people getting infected and dying. Is that correct? Is that still the case?
I don't have the specific local data on the deaths. We can reach out to the hospitals and check. We have been averaging typically over the last several months, it's been 0 to 3 deaths per week. And so is it new cases? I don't necessarily know if it's new or if it's people who had been sick for a while, but we do have a lot of residents who have serious health conditions or are quite elderly, so that when they get COVID, it is much more dangerous. So I think it's probably a mix of that. But I believe it just anecdotally in conversations I've had with the hospitals, there are some new cases mixed in there too.
I guess the coroner might have that information as well.
Yes, potentially.
Thank you.
Mr. Chair,
Mr. Brown.
comment, Brown speaking. Michael, this is just a comment. One of my daughters got COVID just a couple weeks ago, maybe 3 now, and did a home test. Okay. And stayed home and isolated and the whole stuff. Got really worn out and congested and head and everything. And it kind of, after a week, she thought, well, maybe this has turned into some type of sinus infection because her ears and her head were just so plugged up. So she went to urgent care on Sunday and they took her in, obviously. And she said, that she had done a home test and it tested positive. And so she said, I don't know if will you do another test on me? And they said, no, not unless you want us to. And they checked for sinus infection and stuff, and she didn't have anything. So she got told, go home, you still got COVID. But I just found that interesting that they didn't do a test so that they could report to you their results. That they just went off of somebody's home test. I just found that interesting.
Yeah, I think we're in an interesting time right now with testing, and because of the widespread home testing, it is something that most places are accepting. So if there's not additional things that are going to happen, I can understand them.
I just thought that they would want more data, who's got what strain, things like that.
Sure.
Yeah, but
I think there's also a cost involved, and if you already know you have it, then potentially they're not going to test you for it again because they're not going to learn any new information, right? But your point is true about it getting reported to us, but that's probably not their priority.
Yeah. I think Omicron just changed everything when it came to actual cases.
Yeah, definitely.
Any other questions about COVID before we move on? All right.
One more, sorry.
Mr. Shepro?
Yeah, there's been briefly a flurry nationally about whether the pandemic is over or not over. But I guess my question is that some people have suggested that if it is officially declared to be over, that would have a ripple effect on a lot of health initiatives, health emergencies, and so forth that have been declared, which might go by the wayside if there is some legal determination that the emergency is over with. And I wondered if you had any thoughts, Michael, or information about that, because that would seem to be something that would have to be rather carefully thought through.
Absolutely. I think that's a good point. And many people have made comments about, we're through this, or now it's over, we're back to normal. And I think those are more informal comments as opposed to here's an official statement from an organization. In the case of a pandemic, because it literally is a worldwide issue, it's possible that we may be through the worst of it and the pandemic is still going. So at the global level with the World Health Organization, they may not say the pandemic is over. Or it could be the other way, right? Because there's many countries where cases are going up right now. So I think we need to be careful, but just like most things through the pandemic, it's my belief that we can talk about the pandemic being over, not over, these rules go in place or what have you. But at the practical level, just in, trying to be a sensible person, we're still seeing a lot of people get COVID, much, much less than what we had been seeing. But we're still seeing almost 100 people a day that are being reported to us. People are still dying. So even if somebody does declare the pandemic is over, it's still something that we need to be mindful of and take seriously. But then to your point, Mr. Shepro, about the funding, yeah, that absolutely, for disaster declarations and things like that. I think that is an important consideration when people are making those kind of statements. Definitely.
Thank you, Michael. Thank you, Mr. Chairman.
Thank you, Mr. Shepro. Okay, Michael, if you'd like to continue with the rest of your presentation.
Right. So just a few other things that are going on. Monkeypox, fortunately, seems to be leveling out a bit around the country. We're still at 11 cases. We do have 4 partner clinics that are offering vaccine, and currently our team is coordinating the delivery of the TPOXX antiviral medication. So that seems to be going fine. Knock on wood, we're still trying to get education out to people to make sure they're taking appropriate precautions. Quick note on the asylum seekers. This is something else that's been in the news. And there's obviously a strong political bit of theater going on here. So stepping back from that, what we focused on is what would we do if a busload of people showed up in one of our Kane County communities. So we did convene the hospitals and the federally qualified healthcare centers just to talk about it, because some of these people have been traveling for months and have really had a difficult journey. So even though we don't like the idea of a busload of people just showing up without a link to resources and things like that, from a humanitarian perspective, we do want to make sure that if something like that did happen in one of our communities, that we would be able to assure people are taken care of in a humane way. So we are working closely with the Illinois Department of Public Health, the Illinois Department of Human Services, and the Illinois Emergency Management Agency. In Kane County, the Kane County Office of Emergency Management is taking the lead on the planning. Our emergency planning folks at the health department are strongly connected with them. So right now, it looks like the intent is to try to keep most people in Cook County where they can have their medical screening and the welcome centers are set up and things like that. But we have been warned that there is the potential that people could show up in our communities. We don't know how long this is going to last. One thing that anecdotally keeps being repeated is there could be 1,000 people a week for 13 weeks coming up from Texas. So again, just stepping back from the political side of what's going on, we're here and we've connected. So we all know, especially over the last couple of years, that our social service agencies have been really strapped because of COVID. Our shelters are at an overcapacity. People have not had access to the volunteers that they've had. So our safety net system has really been strained over the past couple of years. So having people just show up is an additional strain. But that being said, we do want to be able to take care of people if they show up. So if anything happens on that front, we'll let you know. But again, we really want to be in a support role to help any of the municipalities if people do show up there. Any questions on that?
Mr. Chairman Bates, please.
Go ahead, Bates.
I want to say thank you so much, Michael, Mr. Isaacson, for this proactive effort to show our humanitarian side. So yay, thanks.
Thank you. And then we have been working in the city of Aurora. Just as a reminder, there was something called the Reimagine Public Safety Act. And many communities around the state of Illinois were identified as places where money would be invested to reduce gun violence. So starting in March, Chairman Pirog and myself have been working with a group in Aurora, working closely with city government there. Gun violence has gone down tremendously. I live in Aurora, so gun violence, we're actually on the list of communities that are eligible for funding right now. Aurora has the lowest rate of gun violence of any of the communities. So I think there's been some tremendous work done over the past couple of decades. But just over the last week or so, we did work with 2 community organizations to submit grants. We're hoping to bring about $1 million into Aurora to help with youth support services. So I think it's a positive thing that I think is going to be pretty exciting. Again, only Aurora was eligible this time, but we'll keep an eye on other opportunities as well.
Bates, please.
Go ahead, Bates.
Me again. I would like to know more about that, Michael, and see if I can help here in
Excellent.
Aurora. Can I just give you a call?
Definitely,
Okay,
absolutely.
thank you.
May I speak?
Madam Chair, go ahead.
Hi, thank you. Yes, I would like to commend that whole committee. We have been meeting now for since March, I believe, spring. And the applications have just been gone out on the 19th. And everyone has worked diligently, and you've heard some of it already, Ms. Bates. You've heard this conversation about the importance of the Fox River Water Trail and using kayaking and nature as a way to mitigate tendencies towards violence, to give opportunities for these young people to have other activities besides other activities that they may be doing, whatever those defined activities may be. So hopefully those will be funded. I have spoken to the governor about it, and he has, perhaps given us a smile and a wink, but that is yet to be determined because they are competitive grants. But I do hope that Aurora benefits from this. As Michael said, we have been selected. There are, I think, 50 communities throughout Illinois, and Aurora made the list, is at the bottom of the list, but nonetheless made the list. And our goal is to get Aurora off the list. So once the grants are coming through and we hear about it, obviously, we'd love to have your support and your help with this. The organizations are just been working very hard. It was an onerous grant, and I do applaud Michael and these not-for-profit organizations for.
What were the nonprofits, Madam Chair?
African American Men of Unity.
Oh, right.
And Michael, what was the other one?
It's a group called Light, which is Leaders in Transformational Education. But we also, there's a big group of people around the table who've played a great support role through the whole process.
So it was an extraordinary collaborative effort that we have been working on, sometimes with much dialogue and conversation. So fingers crossed.
Mhm.
We'll look forward to that. Okay.
Just want to give a quick update on the Thrive by 25. This is something that's very important to me, addressing mental health and really coming up with our multi-year plan coming out of the pandemic. So I have formed a kind of a key planning group here. So what we're going to do is we're going to put together a 3-year plan to address mental health, substance use disorders, and trauma in the community. And this can include loss of loved ones because of the pandemic, the pressures financial pressures that people have experienced. You'll see just watching the news that everybody is pretty frazzled and pretty fried right now across the country. So we have a good group of professionals around the community that have been giving me input on this, and I'd hope to launch this in early October, but as I'll talk about in a couple slides here, we have another event that the health department's doing. So we've decided to put that off for another month, but this is going to be something that is going to be very exciting, and topically, I think this is the most important. You've heard me talk about this a lot, but this is the most important health issue that's facing our community right now. So more to come in future meetings on this. A couple updates. Just quickly, we've launched something that we call solution squads. So I'm a big believer that you hire the smartest people you can and try to stay out of their way. So we have 5 teams going right now with the health department. One team looking at how we conduct our community outreach. We think there's a lot of opportunity to improve that. So there's a team who's going to make recommendations here in the next 30 to 45 days to me about what else we should do. We have another group looking at our website and social media and different things that the health department can be doing. Looking at how we store our files, which is one of those things like kind of cleaning your basement, which is no fun at all, but it is problematic when people can't find the documents that they need on our network. So we're working on that. And then looking at how we train staff. So those are 4. And then on the management side, with our leadership team, we also have another squad that I didn't put up here that's looking at how we manage our on-call, just to make sure that it is that we're set up to appropriately respond to the public 24 hours a day, which we are, but also that that is distributed between our team. So it's not too onerous for just a couple of individuals who are getting a lot of the key calls. Just wanted to highlight, we have 3 new team members just joining us this week that I'm really excited about. So Maria and Lorena, both bilingual, doing community outreach. Maria is joining our Children's Mental Health Initiative and is going to be working with families there. Lorena is going to be working with our AOK Early Childhood Network doing family engagement. So excellent that we're going to be out in the community, better connecting with people. As I've mentioned, having that voice of the community is critically important. So they're going to do a great job with that. And then Sean is just joined on our vaccine side. I haven't had a chance to meet Sean yet, but we'll be helping with the COVID vaccine. So the staff is the strength of our agency. So just want to kind of highlight when we bring new people on, and I'll be sharing stories about existing programs. Actually, it was just mentioned to me at one of our all staff meetings. We always highlight the new people. What about the people who've been around? So both in our internal meetings and here, I'll make a point to share a little bit more with you, just so you can see who's out there doing all the great work. Couple things coming up, which you should have received information about. So this one is the 24th. This one is in the future. We have the Kane County Hunger Summit. So encourage people to participate in that. That'll be Saturday at the Northern Illinois Food Bank. And I'll click through these pretty quickly just for time's sake. We have a Spanish language suicide prevention dialogue that we're going to be hosting on the 29th. So Hablar Salva Vidas, or Talk Saves Lives. So this is something that we're doing in partnership with the Gale Board and Library. Our team that's with the Children's Mental Health Initiative has been spearheading this along with a couple of other organizations in the community. So I think this is a good way to get out and talk to people. We also have another event, which I didn't put up here, where we're working with the school districts on how to better prepare to talk to students about potential suicide and how to prevent it. We have our Kane Counts Symposium. So this is our annual kind of public release of what it is that we're talking about as our key health priorities. So not only will people be able to hear what the key health priorities are, but this year we've decided to focus on social connectedness. This is something over the last few years that is continuing to rise up in the literature in terms of really being a protective factor or a risk factor. I've been keenly interested in this for a while. There was a book probably 15 years ago called Bowling Alone that was looking at the decline in kind of those social things in America. So there's no, the premise of that book was, and it's a research-based book, there's not bowling leagues and things to the level that there used to be. And, you know, I would say when you look at our potential inability to communicate with friends and neighbors about politics and about policy and things like that, it's much easier just to delete people from Facebook, and I'm not going to talk to that person because they have a different political opinion than me. Whereas if you were in the bowling league, you still had to be around each other and you still learn to work through those things. Interesting point that stood out to me about 10 years ago. I was at a national conference talking with some of the people involved in this research, and they could do a measure where you would look at the social connectedness of communities. And the city of New Orleans had one of the lowest levels of social connectedness. And this was just after, maybe a year or two after Hurricane Katrina. So when you look at not only daily the impact that this has on people, potentially negatively if there's not connections, but especially if there's an emergency or a disaster. And certainly going through the pandemic is something that's strained everybody. But we're seeing plenty of natural disasters around the community. If people don't have those social connections, it really hurts at the public health level and on the individual level. If somebody's just sick, if somebody has a cancer diagnosis or something like that, and they don't have a social network, their outcomes tend to be much poorer. So this is something, the social connectedness is a little trickier to talk about with people, I think, because it sounds so soft, but the research is actually quite strong about how important this is. But encourage everybody to join it. This is going to be online again. We hope to get back in person next year for this event, but one more year of Zoom at least.
Comment, Shepro?
Shepro, go ahead.
Yeah, to that point, those of us of a certain age remember when you could be 7 or 8 years old and you could still go out on Halloween and go trick-or-treating. Now, presumably, parents don't even think about allowing young children to do that. And the same thing, when I was growing up, everybody knew their next door neighbors, and you see that going. So, but I think that what we've seen is that with the growth of, I suppose, violence and pandemic, that trend seems to have accelerated dramatically. But I think it's also something that's sort of been percolating for a long time. And I agree. I think that you see, I remember during the redistricting process, a number of people from Aurora would talk about their communities, and very few people talk about it in the sense of neighboring communities anymore. Everybody seems so compartmentalized, and it's so I commend you for that, those initiatives.
And something more fun, we do have International Walk to School Day. This is something that the health department started, this Making Kane County Fit for Kids initiative to get better nutrition and physical activity for kids in Kane County in an effort to reduce obesity. We spun this off and launched it as its own 501c3 several years ago. So now the health department is a board member. You can see across the bottom of the flyer, our Division of Transportation, Northwestern Medicine, the United Way, and Rush Copley are the board members. Every year, and this is the 12th year, we took 1 year off during COVID. We will provide a $150 stipend to the parent-teacher organization of an elementary or middle school that participates in Walk to School Day. Many of you maybe have participated over the years. It usually is great, and the mayors are out, and the superintendents are out, and the police departments and the fire departments. At its peak, we were having around 90 schools participate. So we had a little bit less than that last year coming back after the COVID. So we're looking to re-engage. But this is just a fun way to get people excited about active transportation. And then, not to get too philosophical about it, but there's actually good research too about walking to school is really good for people's mental development. because you're making decisions. And so you may have heard me use these examples before, but as our society moves to a child may be in 10 activities and get driven around by their parents to all these things where every activity is organized by an adult. And there's some positive things with all that, certainly. But walking to school, riding your bike to school, you're forced to make decisions. And so are you going to throw that rock or not? Are you going to cut across this yard or not? Those are important things that I think in terms of resiliency is really important for kids to do. And again, this is actually research-based, that it gives young people an opportunity to not be in a structured environment their entire life, where then when we send them out into the world, and we may be seeing this right now where you have young people that just don't feel prepared. So again, kind of a throwback type of thing, but in addition to the physical activity, which we're most actively supporting, I think that's another thing that's important about this. So just a few things that are going on in the community that I wanted to, yeah, please.
Ms. Bates.
I didn't know you were going to go to comments or questions. I have a question. First of all, I just tried to register for the Hunger Summit, and I was told this meeting is for authorized registrants only, and I used my Kane County Board email. Am I not an authorized registrant?
I'll look into that. You should be able to register. So I don't know if anybody else has had difficulty.
Bates at kanecoboard.org.
I was
Yeah,
going to
no.
ask how you go about doing it, but Mavis has apparently already figured that out. So,
Well,
Shepro.
I took a picture of the QR code on the computer screen, which is not because whenever I see that button that says register here, it's not a real button. So, and then I have one other comment about the walk to school. My older daughter walked to school every day, and she has this fantastic sense of direction. My younger daughter got driven to school every day, and she can't find a way out of a paper bag. So I think there's something to do with just developing your brain in many ways for walking to school. So I love it.
Oh,
Madam Chair.
oh, yes. Excuse me, Monica, if I may, I'll be quick. I've lived in two communities long terms now in Kane County, St. Charles as well, and separate communities in St. Charles and now Batavia. And what I noticed in my first community that I lived in St. Charles, which was an older community with sidewalks and it was a grid, as well as here in Batavia, is that students walk to school. There is a local elementary school. Before there was also a local middle school. Children, moms, dads would walk their kids to school on a continual basis. And excuse the dog, I'm at home. Nuggie, hush, hush. But when I lived in Fox Chase, there was more driving children to the high school and to the middle school, as well as to the elementary school, because it was further away. So there was much more bus traffic of students. So, and I know where Mr. Shepro lives and many other board members, it's much more rural in development and not, schools are a little bit further away. There's not the sidewalks. Children may walk in streets because there's not sidewalks or sidewalks on one side of the street and not the other. So as we look at development of future planning, having walkable communities that support bicycling, that support these kinds of decision makings that are both healthy for students and healthy for everybody, to have walkable communities is something we should consider. And I believe that walkable communities oftentimes are safer than those communities which are relying much more on transportation. And I'm going to quiet the dog down. Thank you.
Comment, Shepro?
Go ahead, Shepro.
Yeah, to that point, the last version of our land use plan for the county that I was privileged to work on as a member of the Regional Plan Commission has a major health component, and walkable communities is one of the strongest emphasis in that plan. And I would encourage everybody who hasn't looked at it recently to go back and take a look at that and think about how that can be utilized in your own community. So I thank Madam Chair for that observation. And if we are on to questions and comments generally, I have a question for Mr. Isaacson.
Go ahead, Shepherd.
Silva,
Oh, Dr.
Yeah,
Silva,
let's take Dr.
sorry.
Silva first. We'll come back to you.
thank you. So, Corinne, just actually, your points were exactly what I wanted to say. This summer, I had the opportunity to walk to my office, which was about 6 miles, and there are some not easily walked areas in our neighborhoods, and so again, I would also like to underscore that moving forward, we could be very supportive of initiatives that present us with more walkable streets, because it isn't always easy. It's fun to do. It's very relaxing and it's great exercise. It's the best exercise that there is. But we still have regions where it's not quite as easy to walk. And I'm not talking busy cross streets, because that's somewhat to be expected. Just even sidewalks along streets near our homes that are just not easily walked. Thanks.
Any other comments?
Mr. Chairman.
Oh, sorry, Mr. Shepro.
Yeah, Michael, I've seen some articles in the last week or so on polio. New York State apparently has declared a public health emergency about polio in the state of New York. And the articles I read is that they were concerned both because there have been a recent outbreak there. It also says that their health department discovered that the current statewide average of vaccination for polio was only 79%, and they wanted to raise it to 90%. And then I saw that the Herald had a follow-up article, I guess it was, I'm looking at it, Sunday, August 29th. There was a reprint of a Washington Post that was kind of a Q&A about polio. And again, I'm old enough to remember when parents and children alike were really just terrified about the possibility that they could contract polio right about the time that we had the first vaccine and then the oral vaccine. And I remember my first polio shot, which wasn't pleasant. The needle was about 8 feet long, and as those of us that are of a certain age remember that. But I wondered if you had any thoughts about what's happening in New York, and is that something that we're looking at here or concerned with? The article also went on to talk about developing countries, especially seem to have fallen behind in vaccination, and with people traveling all the time, of course, you can't compartmentalize it.
Yeah, exactly. That was going to be my first point, sir, is, what happens somewhere in the world potentially can happen here. And with infectious diseases, that's certainly true. So I think having a strong public health system globally is important for the health of people living here in America. We are concerned about people, and we certainly saw it to the nth degree with COVID shots, but people being less interested or less trusting of vaccines. That's something that we've been watching for many years. When we have my sense of time's off. About 5 years ago, we had measles that popped up in Kane County. These are vaccine preventable illnesses. We do work closely with our schools and have pretty good vaccination rates. But there still is a small percentage of people who are using exemptions to get around that, and some adults who did not get vaccinated themselves. So trying to address that vaccine hesitancy, I think in the coming years is going to continue to be a public health challenge. We actually had a special grant that unfortunately was during COVID, but a grant from the state of Illinois where we were able to do some focus groups in the Chicagoland area. And COVID certainly exacerbated people's mistrust of vaccines. So one point that we try to make, and again, this is just my approach to most things, is try to meet people where they are. People who are opting not to get their children vaccinated, those aren't people who don't care about their children, right? So what we want to do is to give them the best information so that they can make the best decisions for themselves. From a public health perspective, I disagree with their decisions not to get their children vaccinated. But we have found through research and just by talking to other human beings, sometimes that just telling people how foolish they're being or how dangerous they're being can be counterproductive. So we want to make sure that we have set things up in a way that really strengthens that parent's viewpoint where they have the decision-making ability. Now, again, in public schools, we have requirements. We try to tighten up so that it's not too easy for people to get exemptions. But what we see is it's more in private schools where people they're a little more forgiving, where the vaccine rates are a little bit lower. And then again, with international travel or people new to the country, they may bring in an infection that previously wouldn't have been a problem if we were all inoculated. But because we have pockets of people who are not inoculated, that's how you start to see issues. So
thank you. Two things jump out at me from the articles. One is polio is incurable. And two, it is 100% preventable with the vaccine.
Right.
Thank you.
Do we need boosters?
No, the article says no. If
Okay,
you've been vaccinated, you're okay.
all right, thank you.
For polio, other things you need boosters,
Mhm.
says Dr. Shepro. Maybe
Thank you,
Dr.
Doc.
Soto.
Thanks, Doc.
Yes,
Always consult with your physician before listening to this meeting.
exactly.
Another question.
Brown, go ahead.
Michael, or maybe Jarrett, as chairman of the ARP committee, could you give us an update or refresher on where we're at with the $10.8 million, I believe it was appropriated for mental health initiatives?
Absolutely. So for all of the health department requests, we're just putting together some of the final details to code it correctly with the federal codes right now. And then I'm hoping that next month we can get in and start moving those things forward. So
Okay.
I'm just providing some additional information now. Have had a meeting with the state's attorney's office. I think have answered most of their questions. We had a meeting with Ernst & Young, and the coding is not really an open question, but it's just additional detail that's needed. So,
But behind the scenes, you've been working on getting
Yes.
this program running
Yes.
so that when the money is available.
yes, and actually the timing, this wasn't intentional, but it's going to work out with the Thrive by 25 is going to perfectly align now. So we're going to have a plan that we'll release to the community, and then we'll be able to fund in those need areas and using the plan to really get people engaged in the process.
Perfect. Thank you.
And then we also have some important things around chronic disease that we have ARP requests in. We do have some needs for COVID still that we're going to be looking at and getting out into the community. So all of that should be coming forward here very soon.
May I ask one more question?
Madam Chair?
Thank you. Michael, I just, as many paid attention to the news yesterday, apparently the anxiety now is going to be tested for adults. That's going to be a normal part of one's physical exam if you are suffering from anxiety. I think to adults who are up to 65 years old. I think many of us will fail that exam, depending on one's job or school. Have you had, perhaps when, I know it's all brand new, but perhaps at our next meeting, you can enlighten us of potentially what this test is going to be so that we can prepare ourselves when we go for our next physical.
Very, very good. I will do that. Thank you, Madam Chair.
No copying my answers either.
Mr. Chairman,
Ms. Allen, go ahead.
oh, thanks. I'm sure that you guys have noticed that Superintendent Michael Davis of the JJC sent out his newsletter. I'm sorry, I don't remember if he does that every month or quarterly, but anyway, it's in your mailbox fairly recently. And I just wanted to, well, for one thing, we should commend him because the JJC went through its review, its audit process, and it was the he seemed to think that our JJC was the only one that came back with complete compliance and a whole series of best management practices which go beyond compliance. So that's really wonderful outside of the box thinking and preparation. But the reason I'm mentioning it this morning is that he said that what they've discovered with the youngsters who come through the JJC is that by far mental illness, mental health concerns are what are driving these kids. And sometimes there's severe problems where kids are trying to commit suicide or acting out in such obvious ways that they end up in emergency rooms. And emergency rooms try to place the kids if they can. They won't put them into the hospital from the emergency room. They either go to a facility to treat their mental health, or they come back to the JJC. And the problem is there just are not enough organizations that take youngsters with mental health problems. So the waiting lists are extraordinary. I think we could take all of our ARPA money, and even with that, we probably could not build another facility in order to take youngsters. So that's just going to be a chronic problem. And it was interesting to me. It makes sense that a kid who's feeling horrible about himself is the one who's going to act out. And it just needs to be on our radar. Thanks so much.
Thank you, Ms. Allen. And before we move on, I would just like to say with the Walk to School program, I'd like to give a special shout out to all the kids that skateboard to school. So
There we go.
Would that include you, Mr. Chairman?
no, you don't want to see me on a skateboard.
Okay.
Not right now. Okay, we do have a couple resolutions, and with your indulgence, I'd like to move one of those up because we do have a staff member, Ms. Jody Wolnick, who's going to present one of these to us, and I'd rather she be able to get back to work, unless you want to have this little break away from the office.
Did that sound?
I think so. Yeah,
Okay.
we can hear you.
Thank you, Chairman. I appreciate that. It's been really great to attend this committee, and I feel like I've learned a lot. So I appreciate you having me here today. I have an ordinance before you. Would you like to do a motion in a second first, or would you like me to go through the ordinance?
Yeah, I'll motion in second, and then we can do.
Tepe moves.
Tepe moves.
Shepro seconds.
We'll give it to Shepro. And Ms. Wolnick, you go ahead and describe this to us.
Great. Anyone that was in attendance at the E&E committee, this was also presented there. I'll give you a little bit of history. Going back in Campton Township, we have a long history of the drinking water wells out there. The issue really came up with the Fox Mill development in Wasco when they were drilling one of their wells. Many of the neighboring wells that were very close by to that well experienced issues with the drop in water levels. And so as the plat officer, Phil Buss, decided to implement a policy at the county level that new subdivisions out in Campton Township would be required to drill their wells down to the deeper aquifer system, also called the St. Peter Aquifer, which is about 600 foot below the ground. He was doing that as the subdivisions were being platted. And so in the period that we had a lot of development in the county, the early 2000s, we had a lot of new wells go into Campton Township. So it's a bit like a Swiss cheese. And in 2016, the Illinois State Water Survey did their annual measurements of well levels out in Campton Township. And they found some anomalies in those well readings and the elevations that they were finding in those wells. And so we worked with them to implement a study out in Campton Township that included the implementation of well and tell units on individual residential wells that were out there and taking readings of water levels in those wells between the periods of 2017 to 2019. A letter report was then completed by Illinois State Water Survey. And in that report, they found that due to the drilling of those wells to the deeper aquifer, many of the well drillers had left the aquifers above open to those deeper units. And that's why we were experiencing these very unusual heads in Campton Township. And more specifically on the east side of Campton Township than the west side, because we have a lot more development on the east side. The concern with this is that we're mixing different water qualities in these wells, and we're also impacting the head levels in the wells. And so working with Illinois State Water Survey, they put together some recommendations moving forward when we permit wells in Campton Township. That would be the ordinance in front of you. It is code chapter 23, which is called Wells and Water Supply. And we've included the detail that has been recommended by Illinois State Water Survey. These recommendations have been forwarded to the village of Lily Lake, the village of Campton Hills, Campton Township. They've all reviewed this and it will apply within those village limits with the exception of the Wasco Sanitary District service area. So it's very technical. It's talking about the different upper units being cased off if you're going down to the St. Peter. If you're utilizing one of those shallower units, that you're cased into the bedrock well enough that you don't have the cross mixing of water from those different units. So any questions?
Any questions from anyone? Nope. Sounds like we're ready to vote. Thank you, Jody. And clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman,
Strathman, yes.
Tepe,
Debbie, yes.
Silva,
Silva, yes.
Sanchez.
Sanchez is yes. Okay, and then we'll jump back up to, I need a motion and a second for authorizing the purchase of COVID-19 testing kits.
Debbie moves.
Debbie
Strathman
moves.
seconds.
Strathman seconds. Mr. Isaacson, if you'd like to just briefly describe this one.
Sure. So this is a grant that we have. We do have a focus on health equity. So we want to make sure, one, if people should know that if they're insured, they can go and get a limited number of test kits at the pharmacy and bill it to their insurance. But for many people who aren't insured, there's still a struggle. So we want to make sure that people have access to these test kits. So again, it's 100% grant funded. And this should meet the needs of our community as we see it.
Any questions on this resolution? Hearing none, clerk, please call the roll.
Lewis,
Oh, I'm sorry, Lewis, yes.
Shepro,
Shepro, yes.
Strathman,
Yes.
Tepe,
Debbie, yes.
Silva,
Silva, yes.
Sanchez.
Sanchez, yes. All right, nothing for old business. I would request unanimous consent to place the reports on file.
Debbie
Shepro, so
moves.
requests.
Tepe requested, no objections, reports are on file, no need for executive session or nothing under new business. I just need a motion to adjourn, motion and a second.
In honor of Mr. Kenyon, I so move.
Tepe moves,
I'll second in honor of Mr. Kenyon.
Shepro seconds. All those in favor say aye.
Aye.
Thank you, everybody.
We made it under the hour mark just by